We're continuing with our coverage today of that nationwide strike by members of the Health Workers Union Nehawu, who are demanding about a 10% wage increase, while government is offering just under 5%. We can talk now to Dr. Percy Mahlathi, the Deputy Director General for Hospital Services of the Department of Health. A very good evening to you, Doctor. Grateful for your time. Just how widespread has the disruption as a result of the strike been?
Well, it's been across the country, but more intense in Gauteng. I think our epicenter, if I were to put it like that, is Gauteng, Eastern Cape, KwaZulu-Natal, and Free State. The other provinces, yes, there are disruptions, but not as intense as in these four provinces that I've mentioned.
Do you have a number as to how many hospitals, how many clinics have actually been affected?
Well, we do have a list of hospitals. It's mainly hospitals that have been that have been affected. I can mention a few without actually saying how many. Like for instance, in Gauteng, I mean, it's been widespread. Charlotte Maxeke, we've had Leratong, Sebokeng, Begimlangeni in Soweto, Tsepong in the northwest. Livingston, Dorang in Zafra Hospital in the Eastern Cape, Grace Hospital in KwaZulu-Natal, Pilonomi Hospital and Universitas in the Free State. So those were the ones that were really hit hard, but there were others that were hit maybe not to the same extent.
And what is the nature of the disruption? We've been reporting today, for example, at Charlotte Maxeke here in Johannesburg about Nehawu members who had blocked the main entrance to the hospital. What is actually happening at ground level?
Well, mainly it's actually the blockade and the locking of gates preventing anybody to leave or even go into the hospital. I think the tragedy about the whole thing is that it directly impacts on very sick patients that are admitted, that you get doctors and nurses and other health workers whose responsibility is to care for sick patients who are prevented from going, to do their work. Some who manage to go in, get intimidated. So we really applaud those that have given time and braved it and make sure that they go and look after those sick patients. I think the irony about it is that should any of these striking workers be injured or be burnt by the fire from those tires, they will expect the same professionals who they are preventing to go to work, that they actually look after them. So it's a little bit of it's actually a big problem. Number two is that this is a general public service strike. It's not a public health sector strike. It's only that unions have chosen what they think is the soft target, which is hospitals where there are sick people.
Mm-hmm. And do you have a clear breakdown of how many workers are participating in the strike and how many are actually still turning up for work since Monday?
Well, our facilities are collating that information on a daily basis, and it varies. Some would turn up, some would not turn up. But clearly, with the strike intensifying today, more workers were intimidated so that they should actually be staying at home. So we don't have a collated national figure. That is something that, where our facilities are working on. And by the end of the week, they'll be able to provide a roundup, for the week as to the attendances and non-attendances at work. And certainly, disciplinary action as per, a public service prescripts will be followed. When no work, no pay, where people have been involved in acts of vandalism, intimidation and all that, they will be charged accordingly.
What is being done by government to ensure the safety of healthcare workers who are still reporting for duty and the patients who are in desperate need of care? Because today there was a report in KwaZulu-Natal where an ambulance was reportedly stopped that was taking a child who was sick to hospital.
Yes, you'll remember, Tamila, that even before the strike, we've had instances where health workers would be assaulted either in the premises or outside the premises, and especially ambulances when they get called sometimes to the township to take care, and you find that is, where it's actually a false call. But relating to this strike, There's been active engagement since it started with the police, the National Commissioner of Police, provincial police, commissioners, and between our minister and the national minister to make sure that the law enforcement does, play its role. What has been
done
it been
successful? Has law enforcement been successful in playing its role when you consider that there are reports where people have not been able to access healthcare services as a result of this strike?
It's variable. There are places where it's been successful. There are places where it has not been successful. But all I wanted to say is that over and above that, the legal steps that have been taken have been to actually go through the labor court, get interdicts, which unfortunately the workers have ignored. Certainly the security forces are intensifying, with their focus now on the areas that are, hotspots. And we have supplied, with the police with the institutions where there is, a lot of activity. Mm-hmm. And certainly we do expect that that will be a moving target. When they see that here there's a lot of security, they might be moving to another, facility. So it's something that would have to be managed because we're sure that the security forces are trained to actually deal with those matters.
And I'm mindful, Dr. Mahlathi, that this is a part of a broader public sector wage issue, so it's not just limited to actual public hospitals, right? But at this point, what are the chances that these workers will get what they're demanding?
Well, if you look at the economy of the country and the way it is performing, I'm no economist. I don't work for National Treasury. All I know that the budgets for the next year have been finalized. Allocation, certainly Treasury has actually finalized. So taking all those factors into consideration, I doubt that, even the country could be able to afford, with that 10%, increase. I think really the onus is upon the national leadership, especially of Nehawu, because it's the one that is leading the disruptions at hospitals, that it actually be able to engage with the government through DPSA at the bargaining council. We are aware that the bargaining council is calling a special meeting for facilitation, right, so that there could be, some kind of halfway, that is met by both parties.
But briefly, as a department, do you understand why these workers are so angry? Because they say, as you say yourself, the cost of living has continued to go up in the last few years, in fact. They work under conditions they say are very stressful, they're short-staffed, even resources aren't always easy to come by depending on where you're stationed, and they feel abandoned, let down basically by their employer.
No, but that does not justify them taking their anger out on very sick patients who are actually hanging on to their lives. That does not justify it, no matter how angry they may be. We sympathize with many of the issues. We've been the first ones to say that we feel that the health sector is not well funded. But it's actually like all the other sectors. But no matter how angry they may be, there is no justification for them to take out their anger on defenseless patients that are fighting just to be able to hang on to life.
Dr. Percy Mahlathi, good to speak to you for the Department of Health.